Welcome to my presentation this evening. My name is Mhackle, and my thesis for my presentation is the use of computerized physician order entry in the hospital setting decreases medication errors. How many of you have received medication orders from a physician that the handwriting is illegible? CPOE technology decreases medication errors by cross-checking the patient's allergies and the dosage of the medication orders. The use of computerized physician order entry in the hospital setting decreases medication errors. I'm going to show that CPOE technology decreases medication errors. One of the major things that nurses and pharmacists have to deal with on a daily basis is illegible handwriting from the physician. This increases medication errors. An incorrect understanding of the intended drug, dosage, route, or frequency of administration can quite obviously produce a medication error, not to mention an adverse drug event. Given the doctor's hurried scribbles, it may be hard for the nurse or pharmacist to tell whether the zero is preceded by a decimal point or not. If the decimal is misread, the dosage ultimately given may be off by order of magnitude, and result could be a tenfold overdose. Poor handwriting can blur critical abbreviations for weights, volumes, units. Milligrams may be confused with micrograms, again leading to an overdose. An order marked as QD or QD might be misread as QID, which is 4 times a day. According to research, indecipherable or unclear physician prescriptions result in more than 150 million calls from pharmacists to physicians asking for clarification every year. So the nurse or pharmacist must contact the physician to ask for clarification. At very least, the process can delay the time that the patient can receive their medications. At worst, a misread order can lead to injury or even death. In an article from the American Journal of Health Systems Pharmacy, the Institute of Medicine's Committee on Identifying and Preventing Medication Errors said, quote, "On average, a hospitalized patient is subject to at least one medication error per day. Studies indicate that paper-based prescribing is associated with higher error rates," end quote. Again, mistakes typically occur when nurses or pharmacists misread medication orders. CPOE eliminates illegible handwriting, reduces medication errors, and improves patient care. This is only one of the steps to increase patient safety. To give an example of the possible reduction in medication errors, I reviewed a letter from the American Journal of Health and Systems Pharmacy. The pie chart shows the difference 1 year before implementation of CPOE and 1 year after implementation of CPOE. The year before, they had 172 medication errors, and as you can see on the chart in orange. The year after CPOE, they had 65, which is in the green. That is a decrease of 62% from 1 year to the other. To illustrate the medication errors due to illegible handwritings, I reviewed examples of illegible medication orders in the article, "Eliminate Handwriting Prescription Errors Within 3 Years." I used one of their examples as my visual aid. The visual aid shows that the difficulty the nurse or pharmacist deal with on a daily basis with poor handwriting from physicians. In this example, the physician wrote an order for Avandia, the one in the middle. This medication is for diabetic patients, but the pharmacist read the order as being Coumadin, which is a blood thinner. With all my years of being a nurse in the hospital setting and my many years of clinical IT experience, I believe that the future, that information technology will continue to play a key role in medication safety. The use of computerized physician order entry in the hospital setting decreases medication errors. CPOE decreases illegible handwriting and dosage errors in the ordering of medications. Therefore, when deciding on the best technology to decrease medication errors, CPOE is your best choice. I want to thank you for listening to my presentation. I'll open it up to questions now. Any questions?
Yeah, Mike, why aren't more hospitals implementing CPOE?
It's very simple. The technology has been around for many years. The most common reason is slow adoption by the practitioners. Practitioners don't want to use it unless they're really sure it is a good system. The price of the system is very high, and the changes in the workflow. Most physicians do not like the change in the workflow between them and the nurses. Any further questions?
Yeah, also in your example on the screen, what do nurses and pharmacists, what are they supposed to do when they receive an order that's illegible?
Well, the first thing you have to understand is when they get this illegible order, the patient has a delay in getting their medications that has been ordered for them. The nurse and the pharmacist have to call the physician and get clarification on the medication before they can prescribe it for the patient. Any further questions?
Yeah, does the government have a timeline for computerization?
Yes, at the current rate, the government wishes to have all the hospitals and physicians' offices on the electronic health record, hopefully by 2015. Any further questions? Okay, I want to thank all of you for listening to my presentation this evening. Have a good evening.